friends, this is Dr. Jaime. Welcome to my show. Today I want to talk to you an overview of gout. Gout is a type of inflammatory arthritis that causes pain and swelling in your joints, usually as flares that last for a week or two, and then resolve. Gout flares often begin in your big toe or a lower limb. Gout happens when high levels of serum urate build up in your body, which can then form needle-shaped crystals in and around the joint. This leads to inflammation and arthritis of the joint. When the body makes too much urate or removes too little, urate levels build up in your body. However, many people with high levels of serum urate will not develop gout. There are some areas in your body that can be affected by gout, like joints, bursa, tendon sheath, kidneys. Especially kidneys, because the high uric acid levels can lead to stones and sometimes kidney damage. But the gout is a disease that can move through several stages. The first, hyperuricemia. It happens when you have elevated levels of urate in your blood and crystals and are forming around the joint but do not have symptoms. Second, gout flares, when you have an attack of intense pain and swelling in your joints. Third, interval or intercritical gout, which is the time between gout attacks when you do not have any symptoms. And last, tophi. Tophi is a late stage of gout, when crystals build up in the skin or other areas of the body. Depending on their location, tophi can permanently damage your joint and other internal organs such as the kidneys. Remember, the proper treatment can prevent the development of tophi. And of course, an early diagnosis, treatment, and lifestyle changes. Gout is one of the most controllable forms of arthritis. Many people avoid gout flares and can decrease the severity of their symptoms and can even become gout-free. Gout is more common in men than in women. Gout usually develops in middle age. Women usually do not develop gout before menopause, which is why women tend to develop the disease at a later age than men. Rarely younger people develop the disease, however, if they do, the disease tends to be more severe. The most common symptom of gout is pain in the affected joint. Many people have their first flare of gout in one of their big toes, but it can also affect other joints in your body. Gout flares often start suddenly at night, and intense pain may be bad enough to wake up you. And in addition, your joint may feel swollen, red, warm, and stiff. Gout flares usually occur in one joint and can be triggered by certain foods, alcohol, certain medication, physical trauma, or certain illness. Flares typically get better over a week or two, and in between you usually don't have symptoms. Some people may have frequent flares, while others may not have another flare for years. However, over time, if left untreated, your flares may last longer and happen more often. If gout is untreated over long periods of time, tophi can develop. A tophus is the build-up of needle-shaped crystals that cause hard lumps to form under the skin, in and around the joints and other organs. Tophi start out as painless, however, over time they can become painful and can cause bone and soft tissue damage and misshapen joints. Some people with gout may be more likely to develop other conditions or complications, especially with the heart and kidneys, like hypertension, chronic kidney disease, obesity, diabetes, nephrolithiasis, myocardial infarction, congestive heart failure. Gout happens when urate, a substance in your body, builds up and forms needle-shaped crystals in your joint. This leads to pain, swelling, redness, and changes in the movement and use of the affected joint. However, not everyone with high urate levels develop gout. Urate comes from purines, which are found in your body's tissues and many foods. When purines break down, they become urate. Normally, urate passes out of your body in urine. However, when too little is removed, urate builds up in your blood and needle-shaped crystals form in your joints, causing inflammation that is experienced as gout flares that cause pain and swelling. Researchers continue to study how genes and environmental factors contribute to a build-up of urate in your blood. However, there are some factors that may increase your chance of developing gout, like having high urate levels, having a family history of gout, increasing age, drinking alcohol, eating foods that are rich in purines, drinking beverages that have high fructose corn syrup, such as a soda. And some health conditions may increase your risk also, like overweight or obesity, metabolic syndromes, chronic kidney disease, high blood pressures, conditions that cause your cells to turn over rapidly, such as psoriasis, hemolytic anemia, or some cancers. Keller-Miller syndrome or Lesch-Nyhan syndrome, two rare conditions in which your body either does not have the enzyme that regulates urate levels or does not have enough of that enzyme. There are some medications, of course, like diuretics, low-dose aspirins, niacin, cyclosporine. Depending on your symptoms and the cause of your gout, treatment plans may differ from person to person. However, the goal for treating gout are the same for each person, like reduce the pain from gout flares, prevent future flares, preventing and resolve therapy to stop damage to your joints, care for other conditions or complications that happen with gout, such as heart and kidney disease. When you have gout, you may be recommended some medication to manage the underlying cause of gout and treat active gout flares. To do that, you can receive over-the-counter anti-inflammatory medications, which can reduce pain and swelling. You can also be suggested to use colchicine, which helps to relieve gout pain. This medication works best when taken when symptoms first appear. There is also the corticosteroids, which can help decrease inflammation, provide some pain relief, and slow joint damage. But the corticosteroids may be given by a mouth or injected directly into the affected joint because they are potent medications, and you will be prescribed the lowest dose possible to achieve the desired benefit. One of the other steps to treating gout is managing hyperuricemia, which is the underlying cause of gout. There are some medications to help with that, but it needs to be recommended by your doctor. Living with gout implies some things. There are many that you can do to help manage gout. You can make more lifestyle changes to help you to have fewer gout flares and manage your symptoms. You can lose weight. If you're overweight or obese, losing weight through a reduced calorie diet and increased exercise helps reduce urate levels, which can help stop or lower the number of flares you have. Also, making diet changes to help reduce blood urate levels and gout flares, like drinking fewer alcohol beverages, avoiding drinks that have high fructose corn syrup, avoiding red meats and organ meats like liver, kidney, tongue, and sweetbreads that are higher in purines and may increase the risk for other health conditions. Also, avoiding seafood such as the shellfish, sardines, and anchovies. Following the dietary approaches to stop hypertension, eating plant, this diet is particularly helpful for the many gout patients who also have high blood pressure. The dietary approaches to stop hypertension eating plan can help improve high blood pressure and may help lower blood urine levels. By lowering urine levels, this plan may help prevent gout flares. And it includes things like eating plenty of vegetables, fruits, and whole grains, eating low-fat or fat-free dairy products, poultry, and oils, limiting food high in saturated fats, limiting sugar-sweetened foods and drinks. When you have a gout flares, you can do some things to reduce the symptoms, like applying ice to the affected area to help reduce swelling and pain. Elevating the affected limb if possible will help you to reduce the swelling. Also, resting the affected joint. When gout is associated with frequent flares or toughy, lifestyle changes alone are not sufficient to manage gout, and medication to lower urate levels in your blood are the mainstay for maintaining gout. Taking the medications prescribed for this purpose by your doctor regularly is the key to prevent gout flares from occurring and preventing or reducing toughy. Nevertheless, maintaining healthy weight and diet are also important to help lower the risk of cardiovascular complications, which are common among gout patients. Oh well, I hope you enjoyed this episode, and we will see you in the next one. Thank you.